Okay, so the very first thing that I want to say is a sacral torsion is not a pathophysiology. It's not something to panic about. In fact, most women's SI joints are going to sit in what's called a left on right posterior sacral torsion because that's the direction of left occiput anterior for giving birth. That's another way of saying don't worry about it. If someone says you're out of alignment, I would take that with a high amount of skepticism. There's no reason to fix a sacral torsion unless it's causing you pain and unless it's actually creating a hip impingement, which could put the hip labral, the hip labrum at risk and other structures as well. The other reason to address a sacral torsion, if it's actually creating pelvic pain, pelvic floor dysfunction, and postpartum problems, as well as prenatal problems. So there's a lot of reasons to address a torsion. And so what I want to say first, again, just to reiterate, is just because somebody says you have torsion doesn't mean it's a big deal or that it matters at all. But when it does, this is one of the things that you can do to subtly change it. Now the sacrum only moves millimeters, so this is extremely nuanced, and I wouldn't suggest you just follow this video and think that you're going to self-correct it. Get with someone who really knows the pelvic girdle, okay? That's the SI joint and hip issues, and preferably as a pelvic PT also, in order for them to really be able to appreciate and understand what's going on. So this is what we're gonna work on. And we've been working on this for a while, so bear with me as I travel around the room here. Okay, so getting into this right position here, she is already versed at checking where her sacrum is. She is having active, it feels like a re-tear of the hip labrum and hip impingement on the right side. And so what I'm gonna have her do is, in this position, she's in a Cobra, because I use lots of medical therapeutic yoga in my physical therapy practice, is she is going to do a spinal decompression. So she's tucking the tailbone under slightly. When she tucks the tailbone under slightly, so go back and do the tucking of the tailbone again. So, yeah, you see how she gets that little bit? Let it go and then do it one more time. Yep, so decompression, she's gonna actually tuck the tailbone because she's having pain in the low back. Now she's gonna subtly lift the ASIS, and I'll show you what that is, so bear with me as I walk some more. She's going to subtly pick up this part of the pelvis right here and bring it backwards just slightly. So let that go again. So that's way too much. I'd say do 10% of that. So it almost looks like she's not moving at all, and then let it go again. Still too much. Give me 2% of that. Good. So she has combined spinal decompression plus a slight picking up of the right ASIS, and I mean slight. Now she's going to activate the left hamstring by pretending like she's going to bend the left knee. She's got that hamstring kicked in, and with no glutes, she's going to press up into her Cobra. All right, how does that feel?
Good. No really pinching like I did before we did the targeted engagements.
Good. So that is one of the ways that you can do what's called muscle energy to change your what you're feeling in the SI joint from day to day, which will really help if you've had a hip scope, hip labral tear, pelvic girdle pain, and particularly SI joint pain for any reason. So I hope this helps.